My name is Alan Geller. I'm a senior lecturer at the Harvard School of Public Health and a director of melanoma epidemiology at the Massachusetts General Hospital in Boston, Massachusetts. Well, we like to say a very, very important saying is that melanoma writes its message in the skin for all of us to see. This is very important because it means that skin cancer is the only cancer that we know that's visible to the doctor, to the patient, and to their family member. So this makes it a cancer that's unlike any other one. We can't see prostate cancer, we can't see breast cancer, we can't see colon cancer, but we can see melanoma and we can find it in its early, most curable point. So doctors have a very important role to play, the patient and their family member. But also we've been finding that many people see other people for care. And so, for example, many people go 8, 10, 12 times during the year to see their barber or their hairdresser. Many people go to see a massage therapist or masseuse to examine and take care of their backs. And so we're trying to involve them as well as medical students and primary care residents throughout the world to try and look for early skin cancer. So hairdressers are accustomed to talking with their customers all the time. They talk with them about social issues, family issues, health issues, and so they're a natural ally. And when we talk with hairdressers, they're very committed to wanting to do this. And we give them a little bit of information. And the most important information is that about 5% of all melanomas are on the scalp, but about 10% of fatal melanomas are on the scalp. And when we go to give talks all over the world and we say to people in the audience, how many of you have ever had an examination of your scalp for skin cancer? Very rarely does one hand lift up. So we realize that hairdressers are primed to do this. They want to do this. A simple amount of training can really help them, and it fills this huge gap that is so important for this very important anatomic site to be looked at. Many dermatologists will tell us that they've had a referral during their career from a hairdresser or from a masseuse. So we're asking people who are not trained as physicians just to briefly look at the skin and to be able to make some observation that something looks a little bit array. And all we're saying to them is to encourage the hairdressers then just to say to a customer, please make sure that you touch bases with your primary care doctor, your GP, or if you have one, a dermatologist. And that's the only role that they can play, is sort of the eyes to look at something that many physicians may not have the opportunity to look at primarily, but will definitely take action on it once it's seen. Well, again, just by the fact that it's the only visible cancer, it's the only cancer that we can all see, is we strongly encourage patients to ask their doctor for a skin exam. In many countries, many people see their doctor 3 or 4 times a year, remembering that the most high-risk people in the world are men 50 years of age and above. They make 3 or 4 visits a year to a doctor. And what we want to ask those people to do is when they go for an exam, those 3 or 4 times, is just to have their doctor do a full skin examination. And in particular, to make sure that they're lifting up the shirt or lifting up the hospital gown to look very carefully at the back. Remember, 30% of all melanoma in men is on the back. And one of the reasons why we think there's later detected melanoma in men is because they don't look at their back and their doctors don't look at the back. So if we can just turn that around, we can make a huge impact on decreasing the number of melanoma deaths throughout the world. Well, hopefully I'm getting his name right and you'll correct me, but there's a wonderful rugby player in your country by the name of Peter Borders, who took it upon himself and worked with skin cancer experts to send a letter to men in Australia to encourage them to have skin cancer examinations. And the simple letter from a very well-known macho athlete prompted thousands of Australian men to have skin cancer examinations. So the combination of TV publicity, encouragement from their wives, encouragement from their doctors, and knowing that in a country like Australia, where 1 out of every 3 people is going to be diagnosed with skin cancer during their lifetime, has really made quite a change. So I'm very optimistic. I'm very positive that despite that macho stereotype and that macho image that we all think about, that people's behavior can change. And we've seen rates of melanoma, particularly aggressive melanoma, drop in Australia and other parts of the world.